Welcome to today's press briefing. We have on the stage two doctors with us, Dr. Zhang Shukwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Larry Lee, Chief Manager of Hospital Authority. The two doctors will give you an update on COVID situation and HA situation. Dr. Zhang, good afternoon. We recorded 4,076 local positive cases, including 1,496 PCR positive cases and 2,580 positive RAT results successfully confirmed via PCR. We also recorded 299 imported cases, including 287 PCR cases and 12 RAT positive cases. The HA reported 3 death cases. I'll give the floor to the hospital authority to tell you more about the situation. Good afternoon. With altogether 1,233 confirmed cases in HA facilities, 163 of them being new cases. As for those requiring isolation, 379 are in isolation wards, 23 in second-tier wards, and 409 patients are now receiving care at the North Lantau Hospital Hong Kong Infection Control Center. Among them, 130 are new cases. We reported 2 patients in critical condition. One had 2 jabs, one had 3 jabs, and 7 patients in serious condition. And for inpatients, altogether there are 18 patients in critical condition and 25 in serious condition, and 5 critical patients are now receiving care in intensive care unit. We reported 3 death cases. That's 1 male, 2 females, age 93 to 99 years old. They're not residential care home residents, and all 3 of them had 3 jabs. The first patient, a 93-year-old male patient, he had 2 jabs. He had atrial fibrillation, hypertension, and also lung disease. He was admitted to A&E unit in Queen Elizabeth Hospital. He was further admitted, and he was not in fine fettle. He was not quite conscious, and his legs were swollen. On the 2nd of July, he conducted an RAT test. The result was not positive. And on the 19th of July, for admission screening, the PCR test result was also positive with CT value above 30. We believe him to be a stroke patient. He was admitted. He had no opacity in the lung X-ray, and upon hospital admission, he continued to have a low blood oxygen level with breathing problems. Resuscitation was administered, and on the 19th of July, he passed away at 23:45 hours. The second patient, a 93-year-old female patient, she was a dementia patient. On the 1st of July, she was admitted to Queen Mary Hospital. She had fever, and the RAT result was positive. On admission to hospital, the PCR test showed positive with a CT value of 20. She had shortness of breath, and also the cardio enzyme level was on the rise, and she was suffering from myocardial infarction. On the 13th of July, she was transferred to Fung Yau King Home for convalescence, and she had opacity in the lung X-ray and also low blood oxygen level. As for atrial fibrillation, she was prescribed with medication. On the 20th of July in the morning, she passed away. The final patient, 99-year-old female, 2 jabs administered. She was a DM patient, also suffering from dementia. She was admitted to hospital via A&E unit on the 8th of July. She was referred by the designated clinic for COVID-19 patients. On the 3rd of July, she had an RAT positive test result. On the 8th, during hospital admission screening, the PCR test result was positive. The CT value was over 20. After being admitted, she was given special drugs and antibiotics. Her condition continued to deteriorate, and she passed away in the morning of the 20th of July. I'll give the floor to Dr. Zhang. We recorded 299 imported cases, including 140 cases picked up at the airport and 113 picked up at quarantine hotels, and also 46 other cases after they've left the hotels. They are respectively from 49 countries, And there are 9 countries which have reported more than 10 cases, 72 for UK, 20 for Canada, 19 USA, and 18 for India, France 17 for Thailand as well, 14 for Singapore, and 12 from Germany, and also 12 from the Philippines. As for the 40 other places, they have reported only 10 or fewer than 10 cases. As for residential care homes, we have recorded an additional case for 1 residential care home, and some residents will be subject to quarantine. We have 2 cases. 博愛醫院賽馬會護理安老院 1 PCR positive and 1 RAT positive. For schools, 335 schools reported 414 positive cases, including 330 students and 84 teaching staff. They are from 78 kindergartens, childcare centers, 143 primary schools, 108 secondary schools, as well as 6 special schools. 193 schools recorded more than 2 cases in the same school in the past 7 days. Today, we have advised some classes of 2 schools to be suspended for 1 week. 香港道教聯合會、雲宣吳禮和 Memorial School, Class 5A. There are 25 students with 3 confirmed cases. This class will be suspended for a week. 順德聯誼會、聯誼總會、良里坊魚、沙田 Kindergarten, K3B, there are 28 students with 2 confirmed cases. This classroom will be suspended for 1 week. As for subvariant strains, please refer to our press release. As of the 19th of July, for suspected BA.2.12.1 cases, roughly, we've recorded 1,149 local cases, as well as 403 cases suspected to carry the BA.4.5 strain. For BA.2.12.1, the cases count for about 2% of total. For BA.4.5, that's about 1% of the total caseload. Now, we've recorded more than 4,000 cases today, so it's an increasing trend, and we're concerned that this upward trend would pose a burden on the healthcare facilities of our hospital system. As for the population having received 3 jabs, the percentage now only stands at 66%. For elderly age 70 to 79, the percentage is 59%. For those above 80, the percentage is only 38%. There is more to be desired. For those who haven't received the 3rd jab, please do so as quickly as possible. We're having more and more cases, which shows transmission chains in the community. The government will step up testing and will also enhance the compulsory testing notices. Members of the public should pay attention to the compulsory testing notices and get tested accordingly. It is hoped that we can identify the cases early so as to curb transmission chains and also curb and to lower the risk of serious and death cases. If you have any discomfort, you should get tested as quickly as possible. Yes, from the HA, 134 patients recovered as of yesterday, including 124 who were discharged, and 1 patient was found to be positive during hospital admission screening. There is 1 close contact for staffers. We have 76 more staffers testing positive. The total count now stands at 25,408. We have 29 more staff returning to their positions. So altogether, 24,867 staffers have returned to their positions. Now, about the rehabilitative ward of Kowloon Hospital, 3 more patients have been referred to the United Christian Hospital for isolation treatment. They are now in stable condition. Altogether, in the ward, there are 6 patients and 1 staff member who have tested positive. We are now investigating the link. In light of an increasing number of cases in the hospitals, this poses a pressure on our beds as well as manpower. And recently, some asymptomatic patients only tested positive after they had been admitted. We have been very careful, but the virus is highly transmissible. It's easy to have nosocomial transmission. Meanwhile, we remind everybody to be vigilant, and we also step up testing for staffers to minimize in-hospital transmission. We'll continue to monitor the situation, and if need be, we can deploy more manpower to take care of patients. As far as patients are concerned, we've just started teleconsultation service for patients. For patients under home isolation, they can ring the support hotline 1-833-6115 of the hospital authority. We will identify suitable patients, and then by using the HA Go app on the mobile phone, these patients can receive teleconsultation service. Afterwards, there will also be delivery of prescribed drugs to patients' homes. We would like patients in stable condition to receive consultation at home so as to prevent deterioration of their condition and also alleviate the pressure on A&E units and other wards so that we can focus our efforts in taking care of patients in a more serious condition.
It's now question time, so please tell us your institution first. I'm from cable TV. There are reports saying that the government's plans to make it more frequent for care homes staff to take PCR is from once every 2 weeks to once every week. So RAT is not enough. Now the number of cases has risen to over 4,000. So what do you think the future trend is? And I would also like to ask about the 93-year-old lady. After being transferred to another hospital, she deteriorated. So what are the exact reasons for her conditions? Now you can see that in the community, this transmission is quite serious. As for care home staff, they would go home and they would go into the community. So it is possible that they would bring the virus back to the care homes. As you know, RAT is subject to a number of limitations. And if you are early in the stage of onset, or if the viral load is low, then RAT may not be too efficient. So there is a need to step up the PCR test for care home staff. It is to play safe. As for the figures of confirmed cases, yes, it's on the rise. But it's not like in February or in March, the figure doesn't rise that rapidly. We see a gradual upward trend. Now, in 1 or 2 weeks, the figure may double. At the moment, we do not see a downward trend. For the 93-year-old lady, I cannot be 100% sure. We look at her blood level, and we have also looked at her EGC, and she has the types of heart problems. So we think her death may be caused by the complications of her heart conditions. I'm from Now TV. The government plans to strengthen the anti-epidemic measures for care homes. That is changing the bi-weekly tests, PCR test to weekly. And what's the inoculation rates at care homes now? And how likely would there be outbreaks in care homes? As for the number of care homes, well, you can see that if the number of cases in the community increases, then care homes would see the same trend. Now, because for care home residents, many of them do not go out. And for those who go out, most of them are care home staff. Even though they have been vaccinated, Omicron is very transmissible. And for vaccination, it's mainly to prevent serious cases or death. It doesn't really prevent infection. So it is possible that they would bring the virus back to the care homes. So for the elderly residents in the care homes, they are quite frail, and some of them have chronic diseases. So if they are infected, their condition may get serious, or they may even die from these diseases. So we think enhancing the PCR test for care home staff would be of use. I'm from commercial radio. 2 weeks ago, you said that the number of confirmed cases would rise to 6,000, and lately we've seen 3,000 or 4,000 cases per day. So what's affecting the trend, and will these figures be maintained for some time? And you are looking at increasing the number of PCR tests for care home staff. Schools are also of huge concern. Would you suggest increasing the frequency of tests for students and school staff? Now, if you look at the figures today and the figure yesterday, we can still see an upward trend. As for schools, all staff and students would have to take RAT every day. They all come from the community. It is an effective and fast way to prevent the spread of the disease. So if they are RAT positive, they should not go back to school. This is to prevent a major outbreak at schools. It is different from care homes because for care home residents, they stay at the homes. And the staff would go to work at the homes from the community every day.
I'm from Bloomberg News. My first question is about whether there's any consideration to remove the RAT testing rule before going to bars and clubs. Yesterday we saw the rule for sending people infected with the new subvariants to centralized quarantine. So does that mean that there's a loosening of policy? My second question is about reinfection trends. Now that we're about 3 to 4 months after the peak of the fifth wave, has CHP noticed any increase in the number of people who are getting reinfections? And which subvariants are these people reinfected with? Are they the new subvariants like BA 2.12.1, or they are still the dominant Omicron strain? Thank you.
Sending people with subvariant to the centralized community infection isolation facility is different. It's a different matter from daily testing of RAT, daily RAT testing in schools, because we have explained that the subvariant, they need a few days, 1 or 2 days at least, to be determined that it's a subvariant BA4 or BA5. And so far, according to the World Health Organization, the severity of this subvariant has not been increased, but the transmissibility of this subvariant is very high. So there's actually we will manage these patients similar to other patients in the circulating strain. But for schools, because we want to prevent major outbreaks in schools, we so far the rapid tests, daily rapid tests among the schools, in the teachers and the students, has successfully prevented major outbreaks in the schools. So we think that this measure should be maintained in the meantime. For the reinfection, for the local cases, locally acquired infection, most of them had previous infection in the waves 1 to 4 waves, and they get infected in the 5th wave. So around 800, more than 800 such cases. But for during the 5th wave, we have not observed a significant increase in number of reinfected cases, maybe less than 10 for those reinfected cases during the fifth wave. So there are only a couple of cases, and many of them cannot be confirmed genetically because maybe we have the recent strain, but we do not have the strain during the February or March. Yeah. I think they have measures to, the rapid tests, right, before going to the bars and the clubs. And I understand these measures will be maintained in the meantime.
下一題。
Next question. This one in black.
TMHK. So can CHP give an assessment of the local epidemic situation as local cases are more than 4,000 now, and are we at the peak now? And second question, care home staffs are already subject to daily rapid tests. Why there's no need to increase testing frequency? And when will the new measures be introduced? Thank you.
I think we have observed and slowly increasing in number, gradually increasing number of confirmed cases over the past few weeks. So the doubling time takes around 2 weeks. So there's no sign of decreasing in number. So maybe we have not yet seen the peak. So with the increasing number of cases in the community, there are a lot of community transmission. So we also observed more cases in the residential care homes. So we are afraid that, the care homes, they are populated with frail elderlies, and they may be suffering from more severe cases or even death. That's why we think that increasing frequency of testing among the staff is a good move to prevent to have early detection of cases and also to prevent outbreak in the residential care homes.
下一題。
Next question. This gentleman in white. I'm from News. I have 2 questions. We have more than 4,000 cases recorded today. Do you know how many of them are in home quarantine? Do they wear wristbands? Do you know about the enforcement situation? Second question, recently we have a number of events and we expect large crowds at the Hong Kong Book Fair over the weekend. Do you have any measures to guard against major outbreaks? For electronic wristbands, this comes under another department as far as dispatch and delivery are concerned, so I don't have figures. As far as I know, confinees are required to wear electronic wristbands. For major events such as the Hong Kong Book Fair, they do require masks to be worn, so I'd remind the public not to relax the effort. They should observe all the anti-epidemic measures, including keeping the mask on and keeping their hands clean and keep social distancing. Next, this lady at the back. I'm from TVB. I have 2 questions. First, when do you estimate we will have over 10,000 cases or reaching the peak? And about the CTN issued last night, the list contains mostly residential premises, not restaurants. Have they to do with the home isolation arrangements? It's hard to predict when we have reached the peak or when we will see a certain number of cases. From the trend, we only know that this is an increasing trend, and we hope that the rate of increase will be slow enough. And we don't want to see many cases. We urge everybody to observe the anti-epidemic measures. Meanwhile, we'll also step up our efforts in issuing compulsory testing notices. Most of them are residential buildings because we do see a lot of transmissions vertically or otherwise in residential buildings in Hong Kong. And In fact, according to previous experience of CTNs, there could be transmission simply by living in the same residential building. Next question, this gentleman on the left. I'm from Mingpao. Good afternoon. I have a question for Dr. Zhang. In the past 2 weeks, we had recorded 3,000 cases per day. Now we have 4,000 cases. So Dr. Zhang agrees that this is an upward trend. And do you have any account for the increase? Has it to do with the percentage of population receiving the third jab? And also, you talk about enhancing the CTN efforts. Can you tell us more? Are you going to change the criteria or include more buildings? And next question. It's mentioned that you expect 300 patients to be admitted to hospitals by the end of July. What is the HA's assessment of hospital admission situation now? Is it necessary to adjust the service delivery? I think the trend we've identified is an upward one at a slow climb. We do hope to see a peak followed by a drop in the number of cases instead of a continuous increase. The rate of increase is not as rapid as the previous waves, perhaps because now we have a wider inoculation coverage, and we also have quite a population having been infected before. This could help in curbing transmission. As for compulsory testing, I understand that there would be more testing notices. For hospitals, the daily admission now stands at 150 patients, and this is a low increase from 1,000 to 1,200 patients admitted to hospitals. We're now having greater pressure on us, and as we mentioned before, we do have a plan. Say for hospital beds, our plan is if the situation deteriorates and if more patients are admitted to hospitals, we will make available more beds. The other point is there could be adjustments to our service delivery, including non-emergency services. We also have a real name rostering system. If necessary, we are going to deploy a certain number of staff members to the North Atlanta Hospital Hong Kong Infection Center, the Asia World Expo, or other isolation facilities to increase our manpower in coping with the increase in patients. More importantly, we need to provide more support for those confirmed cases in home isolation, including teleconsultation service we mentioned. We provide a hotline, and if need be, we can offer teleconsultation for patients using mobile phones. Last question, I'm from AM730. You mentioned enhancing the CTNs. That means including more premises. May I know more about the testing capacity at testing centers and booths? Because previously, you also included some restaurants, whereas for residential buildings, there tends to be more subjects, more people living in the buildings. What about the case of suspected cross transmission as a result of people queuing up for compulsory testing at the centers? Dr. Zhang, you mentioned that the number of infections and the inoculation coverage have led to a slower increase in the number of cases. Does it tally with the saying of mixed or hybrid immunity as put forward by experts? I think the relevant department would keep in view the situation of testing centers, and at the moment, the government strategy is to provide more PCR testing at a lower cost, to do it more expeditiously. So of course, we do hope to make testing convenient. And according to WHO, if a large population have been inoculated, with a large number of people having been infected, you can have hybrid immunity. But with a lapse of time, even if you have been jabbed, even if you have been infected, your immune level could drop. So there would still be a certain level of transmission going on in the community. The speaker is not using a mic. Well, I think the situation at the moment is not as serious. We would not want to see that situation, of course. That's the end of the press briefing.